What are the cervical cancer stages? Explained simply. Imagine your cervix as the opening of a garden hose. When cancer starts to develop, it begins as tiny abnormal cells on the surface of this hose. This early stage is called carcinoma in situ, or stage 0. It is not yet invasive cancer but a precancerous condition, meaning if it's caught early and treated, it can often be prevented from developing further. When the abnormal cells grow into a small area within the cervix, but haven't spread beyond it, we call this stage 1. At this point, the cancer is still confined to the cervix itself. Stage 1 is divided into smaller categories based on how deep or wide the tumor is. For example, if the cancer is less than 3 millimeters deep and only visible under a microscope, it's called stage EA1. If it's slightly larger, between 3 and 5 millimeters deep, it's stage EA2. When the tumor becomes visible without a microscope and is more than 5 millimeters deep but less than 2 centimeters wide, it's stage IB1. As the tumor grows larger, between 2 and 4 centimeters, it's classified as IB2. If it's 4 centimeters or bigger, it's called IB3. Moving beyond the cervix, if the cancer spreads to nearby tissues but not to the pelvic wall or lower parts of the vagina, it's stage 2. In stage IA, the cancer has reached the upper part of the vagina but hasn't invaded tissues next to the cervix. If it spreads into tissues next to the cervix, called the perimetrium, it's stage IIB. Stage 3, the cancer has advanced further. It may have reached the lower part of the vagina, the pelvic wall, or lymph nodes in the pelvis. If it spreads to the lower vagina, it's stage AAA. If it extends to the pelvic wall or causes a blockage in the tubes that carry urine, called ureters, it's stage IIIB. When cancer spreads to lymph nodes in the pelvis, it's stage IIIC1, and if it involves lymph nodes above the pelvis, such as those near the aorta, it's stage IIIC2. Finally, in stage 4, the cancer has spread to nearby organs like the bladder or bowel, or even to distant parts of the body such as the lungs, liver, or bones. If it's limited to nearby organs, it's stage EVA. When it spreads beyond the pelvis to distant organs, it's stage IVB. Understanding these stages helps doctors decide the best treatment options and gives patients a clearer picture of what's happening. Early stages tend to be more treatable and have better outcomes, while more advanced stages requiring more complex approaches. Remember, each case is unique, so it's always important to discuss your specific situation with a healthcare professional. This staging system is based on international medical standards and helps ensure everyone receives the most appropriate care.